It's here first from IPR. I'm Megan McKinney. In today's episode, Republican candidate for governor Randy Feenstra talks more about his tax policies, and later in the episode, taking an in-depth look at federal funding in rural health care. It's Wednesday, April 1st. Happy April Fool's Day. Commercial drivers would be required to pass an English language proficiency test under a bill that passed the Iowa House. IPR's Katerina Sostarek reports.
Drivers who violate the bill could face a $1,000 fine and up to a year in prison. Companies that hire drivers who aren't proficient in English could face a $10,000 fine for each violation and an order to stop operating commercial vehicles. Republican Representative Ann Meyer of Fort Dodge says commercial drivers who don't understand English can pose a threat to Iowans' safety.
By first requiring English language proficiency when issuing CDLs, and then giving law enforcement the ability to level significant penalties and fines against carriers, we could really make a difference removing these bad actors from Iowa roadways.
Most Democrats voted against the bill. Representative Angel Ramirez criticized the bill for including prison time as a penalty for drivers but not for trucking companies. I'm Katerina Sostarek, IPR News.
The Iowa Senate Ethics Committee will not act on a complaint against Republican Senator Scott Webster of Bettendorf. The committee voted 3-3 on separate motions to dismiss the complaint and to reprimand Webster. Jennifer Olson sent Webster, her state senator, an email calling Republican officials fascists and white supremacists. The senator then posted the email on his Facebook page, including contact information for Olson's law office. Olson filed a complaint stating Webster's post harmed her business and led to someone calling her office to threaten her. Democratic Senator Cindy Winkler says many inappropriate things are said to public officials.
But to share confidential communication with personal information included in a public Facebook post is targeting and intimidation.
Republican Senator Lynn Evans says Olson's work contact information is publicly available, and Webster deleted the post when comments got out of hand. He says Webster's conduct didn't violate the ethics code. Republican Congressman Randy Feenstra says he'll press to keep lowering the state income tax and try to eliminate it if he's elected governor. Iowa has had a flat income tax rate of 3.8% since January 1st of last year. Since lowering it, Republican officials have been using the Taxpayer Relief Fund to cover state budget deficits. Feenstra says the state has to make sure there's enough tax revenue to run the government.
It starts with making sure that we have a balanced budget, that we don't spend one-time money. I'd rather reduce tax than have a special bucket of money that it all flows into for someday that we can use it.
Feenstra says any excess tax money should go back to taxpayers. He says Iowa is losing residents to states with no income taxes like South Dakota and Florida. Senator Chuck Grassley says he wants to ensure no discrimination was involved in the USDA's decision to cut funding for a program for underserved farmers. The Increasing Land, Capital, and Market Access program supported 50 grant projects across the country, including 2 in Iowa. A USDA summary shows most of the projects supported Black, Latino, Native, and immigrant farmers. Grassley says he has a history of supporting Black farmers. He introduced a provision of the 2008 Farm Bill that supported farmers who made claims of discrimination against the USDA.
I'm going to make sure that the USDA doesn't discriminate in any way.
The National Young Farmers Coalition says the termination letters from the USDA claim the grants did little to improve land access and overspent on outreach and technical assistance. It's here first from IPR. I'm Megan McKinney. Stay with us. State officials say they hope to get up to $1 billion over the next 5 years from a federal fund for rural health infrastructure. But some say that may not be enough to offset losses from Medicaid funding reductions. More about it in just a moment. Welcome back. It's a Wednesday. It's here first from IPR. I'm Megan McKinney. Over the next 5 years, Iowa hopes to lean on federal funding to update rural healthcare infrastructure. The money is part of the Rural Health Transformation Program. The $50 billion fund was created as part of the One Big Beautiful Bill Act passed last summer, but the same law will also reduce spending for Medicaid by nearly $1 trillion nationwide over the next decade, and that program is critical for rural hospitals. IPR's Natalie Krebs reports some say this new pot of money isn't enough to help hospitals deal with the financial fallout.
Kevin Durandi steps into a suite of empty offices at Mahaska Health, the hospital in Oskaloosa. It's filled with various cardboard boxes, storage tubs, and office furniture.
So this will all be gutted, and the PET CT will be housed over here. Control room will be here.
This is where the rural hospital's new PET scanner will go. The specialized imaging machine is used to detect cancer. In January, Mahaska Health found out it will receive more than $3 million from the state's Rural Health Transformation Program to buy the scanner. Durandi says it will replace a mobile truck. The hospital will more than double its scans, which will help better detect cancer in patients.
To have an in-house PET CT where we can scan patients 5 days a week is significant to reduce the diagnosis to treatment times.
Mahaska Health is receiving some of the first funding state officials are handing out under its Rural Health Transformation Program. For the first year of the program, the federal government awarded Iowa $209 million. Officials say they plan to use the money to make investments in rural cancer care, telehealth infrastructure, and mobile care units, among other things. Larry Johnson is the director of the Iowa Department of Health and Human Services. He says the state plans to spend the money quickly.
Because if you don't spend the money on the projects that you tell the federal government you're going to, they're going to claw the money back. So we are hoping we're organized enough to get it done that we hope to take money from states that aren't able to do what we are.
Congress added the $50 billion rural fund to the reconciliation bill last summer to address concerns about how drastic Medicaid funding reductions could affect rural health care. But some politicians and officials say they see the transformation fund as something different from Medicaid. Robert Cruz is the state medical director.
I think there's a distinction here. You know, our focus is about sustainability and long-term investments for rural health communities, regardless of any sort of Medicaid implications there.
But most balance the two against each other, says Timothy McBride, a professor of public health at Washington University in St. Louis.
It's like, it's certainly an unequivocally good thing for rural to get this $50 billion relative to not having it, but the net effect of all this is going to be negative.
The state hopes to bring in $1 billion total over 5 years from the Rural Health Transformation Program. But health policy nonprofit KFF estimates Iowa will see a nearly $4 billion decrease in Medicaid spending in rural areas over a decade. This is really concerning for rural hospitals, says Iowa Hospital Association President Chris Mitchell.
As soon as the rural health transformation dollars go away, then the Medicaid cuts start to come into place, and that's not a temporary proposition.
At Cass Health in Atlantic, CEO Brett Altman says he expects to see a big reduction in Medicaid funding. He says whatever his rural hospital gets from the state's Rural Health Transformation Program won't come close to making up for that.
So when you break it down to the ridiculous, we know that more than half that money isn't going to hospitals.
But he's trying to get what he can. Altman applied for nearly $3 million through the Health Transformation Fund for a PET scanner. He says he was surprised when the application was rejected. Cass County has some of the highest rates of cancer in the state.
I just don't know if the bureaucrats at the state capitol understand the landscape of rural health care.
Altman says he's spoken to state officials, and he's optimistic the funding will come through in the next round. I'm Natalie Krebs, IPR News.
Great reporting from IPR's Natalie Krebs. I'm Megan McKinney. Hey, thanks for taking the time to listen to Hear First from IPR. Happy April Fool's Day. I feel like I can't prank you through the podcast, but I hope you have a silly day.